These are the post-operative instructions after tooth extraction at Radiant Smiles Dental Care. Since we are using our laser for hemostasis, there is no need to bite on gauze. Avoid spitting or rinsing vigorously to prevent dislodging the blood clot to control bleeding. For pain management, take the prescribed pain medication as directed by your dentist to manage discomfort. Over-the-counter pain relievers can be used if necessary. Usually it's 600 to 800 milligrams of ibuprofen 3 times a day. To control swelling, apply an ice pack on the outside of your face near the extraction area for 20 minutes on and 20 minutes off to help reduce swelling during the initial 24 hours. Stick to a liquid diet or soft foods, and avoid hot, spicy, or hard foods that may irritate the extraction site. Drink plenty of fluids, but avoid using straws to prevent dislodging the blood clot. Refrain from rinsing or brushing near the extraction site for the first 24 hours. Afterward, gently rinse with warm salt water or chlorhexidine to keep the area clean. Rest and avoid strenuous activities for the first day to aid in a smooth healing process. Attend any scheduled follow-up appointments with Radiant Smiles Dental Care to monitor healing progress and address any concerns. Watch for signs of infection such as increasing pain, swelling, redness, or pus around the extraction site. Contact our office immediately if these symptoms occur. Refrain from smoking for at least 24 hours post-extraction to promote healing and reduce the risk of complications. For any questions or concerns regarding your post-operative care after tooth extraction, please reach out to Radiant Smiles Dental Care for assistance. Following these post-operative instructions is crucial for a successful recovery after a tooth extraction at Radiant Smiles Dental Care. Your comfort and well-being are our top priorities.